Israel's assault on the Gaza Strip has already killed more than 15,000 people, many of them in devastating airstrikes that have turned neighborhoods into rubble. But the World Health Organization warns that even more people could die from disease than from bombs if the besieged enclave's health system is not repaired.
No medicines, no vaccination activities, no access to safe water and hygiene, and no food.
WHO spokesperson Margaret Harris on Tuesday said the agency is already seeing a dangerous surge in diarrhea in Palestinian children.
We saw a very high number of cases of diarrhea among infants. And again, there was no treatment available for them. You know, if you have a child with diarrhea, you need to give them rehydration in order to keep them going until they get better. And if you're not able to do that, they can die very quickly from dehydration.
Harris added that nearly 3/4 of hospitals, or 26 out of 36, have shut down entirely in Gaza due to bombings or lack of fuel. Under the terms of a pause in fighting, Israel has allowed more aid to flow into Gaza, including food, water, and medicine, although aid agencies say it is not enough to meet the immense needs. James Elder is a spokesperson for UNICEF.
It was only coming here. I expected the worst in coming, and I was surprised that it was even worse than I'd imagined. Hospitals for children, hospitals full stop, are war zones. I see children with horrendous wounds of war in car parks, on makeshift mattresses, in gardens, everywhere. Doctors having to make horrendous decisions on, who they prioritize.
Israel has sworn to annihilate Hamas, the militant group that rules Gaza, after its gunmen burst through the border, killing 1,200 people and seizing 240 captives on October 7th.
We know that the health system is actually on its knees, and that currently 65%, that is 47 of the 72 primary care facilities, are not functioning. And the ones which are functioning are partly functioning, barely functioning. They say more than 70%, almost 75% of the hospitals are currently not functioning. 25 out of the 36 We've recorded already more than 72,000 cases of acute respiratory infections, over 44,000 cases of diarrhea, 808 cases of chickenpox, 50,000 skin rashes, scabies lice, and we also get cases now of hepatitis A. I want to make the point that before the conflict, we talked about 3,500 hospital beds operational in Gaza. And today, we talk about an estimated 1,400, with an occupancy rate of over 150. Based on our plans, the need at the moment would be 5,000 beds. We need a mechanism for medical evacuation over the coming months to be worked out, that the patients in need, and that is not just multiple traumas. It's all kinds of patients which are in critical need for evacuation. Also think cancer patients which cannot get their treatments. So there's many other patients which should be prioritized for medical evacuation into Egypt. There is a mechanism for the entry of fuel, which would be, I think, the best news of today. And of course, we really hope and plead that this mechanism is going to be sustained, and that it is going to be sustained to make sure that humanitarian operation can function, that UNRWA can do its job and keeping the operation going. So it's all part of
طلع هنا
اسكت يلا
تفضل عيش والله هذا مخدة وهذا منها غطا ومنها ما فيش مية نغسل شايبة الغسيل مكون.
ما توددش
انواع حط رجلك تعال
عشان يجربوا المشروع على خايفة أعملها على الناس تيجي على الناس على الغسيل بطلنا نستلعن عن هذا زهقنا قرفنا وعينا عن جد بنترجى والله يمكن أكثر من 50. تفضلي تفضل لما تفضل زي ضربنا أججنا من البلد منها
يعني أنا عندي لازم حياة، يعني اللي زي هذا إيش ذنبه يعيش في خيمة زي هيك؟
عندك أولاد مريضة؟
الله لا يقدر الحمد لله رب العالمين